Okay, so welcome back. This is our what do we call it? The follow-on meeting?
It's a continuation.
Continuation, sorry. Continuation from our Wednesday meeting, one item specifically, American Rescue Plan funding update. Thanks for everybody for being so flexible. I could see that just the agenda and the topic and the content and what direction we're even going just started going multiple directions on Wednesday. So this is really good to be able to get back together on Friday, more focused onto one item itself. And, let's start at the top. It was an item on our agenda Wednesday, and we'll just work our way through it. And Greg, you have a additional item too. Maybe you want to talk about that to start with, just to get that rolling. This was an email you had just sent us this morning. This morning.
Yeah, sure. For the record, Greg Munn, Deschutes County Finance, and the one add-on agenda request for this morning is asking the board for authorization for either the county administrator or for the CFO to sign the ARPA grant agreements as they come back in. And the reason for that is the board, obviously, the grant agreements that are issued are following the board's authorization of use of ARPA funds that we are periodically going through. But we didn't ask for or specify how to sign those when they come back in. So it's a little bit of a administrative cleanup just to make sure we have record on it, but I'm asking for that, for the board to consider that, and just a minute's motion would be super helpful.
Yeah, so let's follow through with that clarity item right now. Did you get the email? Were you able to see it? So about an hour ago, okay. I've got a copy of it here, and it just lays it out just like that. Who's got the assigning authority? We're having, very public meetings, great discussion about each item that we're approving. Dave?
I just point out with the CARES grants, you did authorize the county administrator's signature. So those all were signed by Tom. We didn't bring those back to you folks after you had awarded them in the various public meetings. We ran those through Tom Anderson for signature authority at that time. And the
So we
board
already have
granted
examples
that.
of this same scenario.
Yeah.
Okay, great. Any other thoughts on this?
I'm supportive.
For county administrator signature?
Or,
Just to get clear.
Or county CFO, either way.
Okay, either one.
The email mentioned either.
Yeah, so would CFO be the easier path then?
I think it would be best to have either.
Oh, yeah, either. Okay, there you go. Yeah, so both, that's fine. Yep. Are you supportive, Commissioner Dare?
Of course.
Okay. Looks like we'll be able to deal with it. So let's make it a minutes motion.
I move approval of either, I move board approval of either county administrator or county CFO signature for contracts related to ARPA funding allocations that have been decided by the board.
I second the motion.
Any other discussion? So just one thought, so these can be anywhere from, I don't know what our smallest one is, 10,000 or 50,000 up to
First one that just came in was $20,000 yesterday, so that was our first.
Okay, yeah, up to a couple $1 million is my point. So yeah, we're going to see a big spread of how much these are signed for. But this will be that package. It'll be well accounted for. The spreadsheet, when these projects get implemented, if people understand, some of these dollars are from the county, and we'll be able to trace it back to every choice we made. So, any other discussion? Seeing none, Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And Chair votes yes. Okay, got some business done.
Great. Thank you.
So let's start off. American Rescue Plan funding update. So this is on the topic of homeless outreach services. So as I say, we started this Wednesday and we started going in, I don't know if it was different directions, but we just had lots of information being laid out. I had discussion with Molly Wells-Darling yesterday and Colleen Thomas, and the request was that they kind of start off with their letter and their ask to explain how it, supports Sisters in Lapine ask. So, because we kind of kept going up and down that logic a little bit. Is that supported to start
I
off
think
with?
that's a great way to start.
Are there any other statements from where we're going or where we were from the commissioners?
I'm still waiting to hear how many homeless we have in Lapine.
Okay. Well, yeah, so let's start off. So we're going to have, after a good sit down yesterday for myself, this is the concept. We'll start off with this ask from Health.
Thank you, Commissioners. For the record, Molly Wells-Darling, Program Manager for Homeless Outreach Services through Deschutes Health Services. And we are here to discuss our ARPA request for an addition of 3 staff, 2 case managers and 1 peer. as well as funding for supplies and changing a coordinator to a supervisor, and also a much-needed vehicle that is a safe vehicle for our staff. So as you know, the homelessness issue in our community, in our region, has increased by about 40% since 2018 and by 13% since 2020. Now, this is based on our point-in-time count, so we know that that's just a picture on one day, and we know that those numbers are larger. So the last point-in-time count, we had 1,099 individuals in the region who were homeless, and 90% of those were from Deschutes County. When we look at what we see, what Colleen's team sees and other providers see out in the community, we're seeing that right now there's about probably an estimate of 1,000 campers in Bend alone.
So a little bit of clarity, when you say Colleen's team, let's get real clear,
Colleen's team
because
is
this is where the facts kind of matter about.
Yeah, so Colleen's team is the homeless outreach team, and Colleen will talk a little bit about what her team does and how many they've served, et cetera, at the, after.
Yeah, so let's just, make that a point in the moment.
Yeah, yeah. So,
Molly, could you repeat that last statistic? So 1,000 homeless campers in Bend alone?
yeah, the estimate right now is that there are 1,000, that's correct, 1,000 homeless campers in Bend alone. And then we average about 77 individuals a night at the warming shelter. And then in our higher barrier shelters at places like Bethlehem Inn, we average around 60 a night. So that's about 1,037 alone, just in Bend, that we can see and that we know about. When you look at who we are serving within Deschutes County Behavioral Health, we are serving about 855 individuals who have stated that they are experiencing homelessness at some point between December 31st of 2020 until now. Commissioner Adair, to answer your question, we don't have specifics overall of how many homeless are in La Pine, but we were able to get the information on how many of our clients in La Pine are experiencing homelessness, and right now that is 44 clients of ours that are experiencing homelessness. So, we can assume, of course, that that number is higher within the La Pine area. Within Sisters, as we discussed on Wednesday, we have around 94 camps and about 110-ish individuals experiencing homelessness in the Sisters area. Let's see here. To break down the numbers just for Deschutes County Behavioral Health, serving people who are homeless, we have, as I said, around 855. 44 of those are in La Pine, 689 are in Bend, and 122 are in Redmond. So as you can see from the numbers, this is a big number, not only just within our own agency, but then all of the individuals that are out there that we haven't been able to reach. Currently, we have two staff, Colleen and Katie. Katie is our case manager and does outreach into the camps, and Colleen will talk more about what Katie does specifically. And then Colleen is our coordinator through our CCBHC grant, and she does outreach, but she also does a lot of community education. She works with all of the different providers. She keeps all of us in this room informed as to what's going on with homelessness. So she does a lot of that coordinating policy type work. So with these two individuals, we are over capacity at this point in time. We do not have the ability to take on anything more. And this is an issue given that we have rising rates of homelessness within Deschutes County. And it's also an issue because we need services for all these wonderful projects that are being approved out there. So we have projects like the Bethlehem Inn. Thank you to all of you for giving money to the Bethlehem Inn to be able to open in Redmond. We have the Navigation Center, and we have Project Turnkey opening in Bend. And then we also may have camps. That remains to be seen, I think, in terms of the discussions around camps. Without services, it will be more difficult for these projects to be successful. And right now, we have had requests. Can Deschutes County Behavioral Health provide the services, just even for behavioral health and SUD, for these different projects? And my answer at this point in time is no, we can't. We do not have the capacity to do that within just these two members. So our hope is that we can get these positions approved so that we can help those projects be successful so that we can continue to reach out into the camps with the ultimate goal of getting individuals housed. This team, just to clarify from other services out in the community, specializes in behavioral health and substance use. They have the special skills that it takes to engage individuals with those issues. So we have a story of an individual that Colleen will tell you later who wasn't able to engage because she was so frightened. And I'll let her tell the story because it's really a great story, and it was her work that ultimately helped this person get help. But it was because of her behavioral health expertise and then also because of their SUD expertise that we're able to engage these individuals and then ultimately move towards housing. And we'll talk a little bit about a program that we had for about 6 months that we had between May and November as well, where we were able to get some people housed. We know that the combination of being able to be in a shelter or being able to be in a permanent supportive housing with specialized case management like this is one of the main things that can get people out of homelessness and to maintain them outside of homelessness. The last bit of statistics I wanted to give you is related to our CCBHC program. As you know, we have our CCBHC program, and we have specialized staff who also work with people who experience homelessness in our county. Our baseline assessment of 504 individuals basically 504 individuals were surveyed and asked if they had experienced homelessness within the last 30 days. 13% of those individuals who filled out this survey with our staff said yes, they had. After 6 months of treatment with our services, that statistic fell to 4%. And after a year of treatment within our services, that statistic fell to 2%. So that shows you that being able to be engaged in a supportive manner with people who are specializing in behavioral health and substance use treatment really can and do make an impact. I'll let Colleen talk, and then we'll have any questions that you have.
Great.
I have a question right now. I believe you said your clients, they total 855? Okay, so that's Bend, Redmond, and Lapine?
It's all of our clients served anywhere. We got, when we were looking at the data, we couldn't dial down into sisters for some reason, so we'll continue to look at that, but those were the stats that I was able to get.
I know, I was going like, okay, where are the sisters ones? They're
I
not
know,
there.
yes,
Like-
yeah. So the stats that we have for sisters are the stats that we did when the staff went out and canvassed, I believe, with the Forest Service, and found there to be the
110.
94 camps, 110. Did that answer your question, Commissioner Adair?
Right, I know, I was just like, okay, the state lost 550 deaths, and I'm going like, where, the number, they're not all coming together, so I'm going, I'm just wondering, are we not, wouldn't you call the people in Sisters, you're not working with them? Shouldn't they be part of the 855?
Of course, this is just a data-driven, how we're pulling the data, and so it probably, it could be related to many different things. That's something that we can probably build in within our EPIC system right now. It's probably based on the team, I know it's based on the team that has them open. We don't have a hub like we do in Redmond and Lapine.
And what about, is there anyone from Terrebonne that's in this count?
Let me look. I didn't bring the specific stats, so I can get that.
I was just, we're trying to cover the whole county, so I just was wondering.
Of course.
Okay, thank
Part
you.
of our challenge with covering the whole county is that we only have 2 staff.
Yeah, right now, yeah.
Thank you, Molly. So for the record, my name is Colleen Thomas. I'm the Homeless Services Coordinator for Deschutes County Health Services. And so, as Molly mentioned, I'm here to answer any questions you guys might have just in regards to what our current services specific to those experiencing homelessness are for our county. Currently, as Molly mentioned, we do have a staff member. Her name is Katie DeVito. She currently serves under a grant, a SAMHSA grant called PATH, which is Projects and Assistance in Transition Out of Homelessness. The county has had that grant for, I believe, over 15 years. And that is a state grant that works specifically with individuals that are experiencing literal homelessness, that have a severe or persistent mental illness and or a substance use disorder. So her role is really to be in the community, meeting individuals where they're at, engaging with them and ensuring that they have access to entitlements, including health insurance, food benefits, applying for Social Security, with the long-term goal, of course, permanent supportive, stable housing. But over that time, and I think I've mentioned to all of you in previous meetings that sometimes, working with individuals that do fall under that category is that it's a journey, and we're walking that journey with those individuals to ensure that it is person-centered, that we are ensuring that those individuals are meeting their basic needs. So again, her role is to be in the community. Currently, yesterday, I think Commissioner DeBone had an opportunity to go out to some of the camps with her. She does a lot of co-responding with law enforcement officers, other CBOs in our community, or we go out together if it is appropriate to engage with folks in the community that are needing additional support. Part of that is really just, again, ensuring that the individuals are having access to basic needs, and some of that is hopefully connecting with our Deschutes County behavioral health team, and part of that is going through the assessment, as we know that sometimes accessing services can be really complicated and really kind of intimidating for some individuals. And so part of that role is to help them get to appointments, attend appointments with them, ensure that there's follow-up, and ensure that they're having access to applying for some of our housing programs, or accessing some of the limited resources that we have in our community, including the shelters. So that is mainly her role in the community. And then myself, as Molly mentioned, we were lucky enough to get the CCBHC grant this last year in 2020 that allowed for us to expand our team from 1 to 2, allowing for really some coordination around all of these projects and programs that are happening in our community that are so vital to the increase in individuals and numbers that are experiencing homelessness. So again, we went from one staff member to 2, and just to kind of go over just a few more data points to mention in addition to what Molly mentioned is, so just in the last year, Katie alone has enrolled 56 individuals in the PATH program, so meaning that those individuals identify as having an SPMI, severe persistent mental illness, or substance use disorder, or co-occurring, and that are willing to engage within our services. So those are 56 individuals in Deschutes County that she is providing daily, weekly engagements with and working on all those different services that I mentioned before. As you all remember, this last year we had an extreme heat wave, and so in August, and so Katie and I alone were out in the community over 3 days and connected with 135 unique individuals in the community to ensure that they were remaining safely in the community due to the high heat wave that we were experiencing. Just over this year, up until this date, Katie has also made at least at least 223 contacts with unique individuals in Deschutes County that also meet the definition of her program. And part of that, again, is it takes time. So we have contacts, we have engagement, and then we have enrollment. And so the real importance of this program and some of the work that we do are meeting individuals where they're at, ensuring that their needs are being addressed on a person-centered approach. The story that Molly mentioned, I'll just briefly mention for all of you, and it's unfortunately a case that is very common to us in Deschutes County, and I've been doing this work for the last several years. There's many cases like this, but this one sticks out uniquely as an individual who was living in her vehicle and didn't have anywhere to park her vehicle. She went to the only place that she felt that she could be safe, and in that location, she worked with that specific agency to be able to remain safely in her vehicle at that location. The people through that facility tried to attempt outreach to her, engage her, make sure that she had access to what she needed. Talked about that really it wasn't a safe place for her to be, and what other options could she have. Many CBOs in our community attempted outreach to her, and it wasn't until our team was able to go out and connect with this individual that we were able to really build that rapport, We assisted her in connecting to both medical and mental health services. She did have a cancer diagnosis. And so we were able to help her get connected to medical providers that were able to address her cancer diagnosis. She was able to be connected to mental health services. And then we, in the long term, were able to get her into permanent housing where she was able to reside. But that took a lot of intensive outreach daily, multiple times throughout the day to connect with this individual, ensure that she felt safe. We're connecting with her family that she hadn't had contact with for years because of her diagnosis and the paranoia she had around family and other community members. So that took time, but that took a really intensive case management and a different approach to be able to meet that individual where she was at. And again, as I said, that's a very common story that we experience in this work of really just being able to look at an individual from a holistic approach and really be able to address the underlying conditions that individual has. If we weren't able to provide that outreach and make those connections, I fear that her cancer diagnosis would have gone unnoticed, and she might have unfortunately passed in her vehicle where she was. And so we were able to give her dignity and respect in her life and really be able to build long-term relationship with that individual.
Fuse as well?
Yeah, so another program that Molly had
One
mentioned
moment.
that we,
Thank you very much for that story and that effort. So that's a success story. And then Eric has some.
I just have a quick question, Colleen. What type of permanent housing, and could you give a quick summary of the steps it took to get her into that?
yeah, so she actually we were able to, she ended up obtaining an apartment through a apartment complex through Epic Property Management that the county actually holds the wait list for, called Emma's Place, which is specific for individuals that do have mental health diagnosis and that go through our wait list through Deschutes County. So to be able to have access to that, she did have to go through our assessment for our housing team programs. And part of that was when we were able to connect with her and really address some of the mental health issues underlying that, we were able to get her into Sageview, which is our acute psychiatric facility, which then increased her vulnerability. And we were, through that, connect her to a mental health team that was able to do a referral to that housing program.
Great. And that's a Housing Works project, right, Emma's?
Yep, Housing Works, I believe it's a 14-unit permanent housing apartment complex that we have in the city of Bend that the Deschutes County holds a wait list for.
And would you call that permanent supportive housing, or would you classify that differently?
So it is considered permanent housing. It's not considered permanent supportive housing because there are not the on-site services for that program. Although we were doing the intensive case management and skills training on-site in her apartment with her.
Thank you.
But talking about permanent supportive housing, Deschutes County was lucky enough to partner with Fuse, which is the permanent supportive housing program here in Central Oregon. Fuse stands for Frequent Users of Systems Engagement, is really targeted to individuals that are chronically homeless, that have high vulnerability and have high contacts with our law enforcement, our mental health system, our hospital system, and they're assessed through our coordinated entry system that really gauges what vulnerability those individuals have. That was an 8-slot program, meaning that there was 8 individuals being able to be go through that process to access housing. Deschutes County, the homeless outreach team, did contract with Fuse to be the service provider for that program. From May to November, we were able to successfully assess and house 8 individuals that were chronically homeless with severe mental illness diagnosis into permanent housing. So that was a huge success. One of those families is a family that I had worked with for 8 years that was living on BLM land in Redmond for almost 8 years. And we were able to work with them, get them through this program of housing. They were able to get an apartment through Epic Property Management. Both of them are addressing medical issues now. Both are now receiving Social Security. Their dog was able to get certified as a service animal and get some medical attention for the dog as well. And they're doing very very well and very successful in their own housing right now currently, and have access to their, they've been able to build relationships with their family. And again, now that their crisis of housing and where they're going to stay every night is taken away, they're able to address those underlying medical and mental health issues.
Since Colleen brought up the family that she worked with, I don't think I mentioned them. I think I missed it in my discussion, but from our point in time count, we have 46% of that 1,099 are families with children in our community. And 65% of that number are individuals who this is the first time they've been homeless. So what that means for our community is these are our neighbors that are losing their homes and becoming homeless in our area. I think it's an important point for all of us to keep in mind.
So one of the scenarios that I'd like to talk about a little bit, I mean, and it's, kind of a rough reality right now, but substance use disorder. So we've decriminalized small quantities of, we've got homeless services, and we know of people that are struggling with substance use disorders, but it's not until they're ready would they take a step. I mean, nobody's forcing anybody to do anything anymore. The public safety isn't. Health isn't. We just kind of document the situation. And I saw this yesterday. I didn't meet the person, but it was explained to me. Yeah, I mean, can you talk about that a little bit? And it's, so I kind of have part of the information here, but yeah, what's the outreach efforts for that? Because, as I say, I just think of it gets bad, and it's not until somebody hits bottom that maybe they're going to, instead of criminalizing, incarcerating, separating them from the bad situation. We're not doing that. We're just making a relationship, I guess.
Yeah, and I don't necessarily think that our approach would be different for someone that has a severe or persistent mental illness versus a substance use disorder. We're going to continue to show up and engage with that individual and talk about what are the barriers, what are those different issues that are, limiting them to accessing treatment or getting out of their current crisis of their substance use. And oftentimes we know, that there is recurring situations with someone that might have a substance use that might lead to their rock bottom. Of course, we don't want to see that, but we also have to look at it as a systemic issue that we don't have enough resources, again, for individuals to access the treatment they may need in that moment. And so we continue to show up. We continue to meet those folks where they're at and talk about what can we do in this moment to provide you safety and security with your current situation. I think that there's some great initiatives, and the county is working closely with some of our treatment providers, Best Care as well, to look at how do we increase the capacity to provide that first person-centered, low-barrier approach to people that are really struggling in our community. And unfortunately, it's the reality. It's a harsh reality that we have. And when we have, as we continue to see the chronic homeless number of individuals in our community increase, a lot of that is due to some underlying issues that aren't being addressed, and some of that is substance use. And so that's, again, where our team, really from a behavioral health approach, is kind of addressing those underlying issues and talking about, that motivational interviewing and harm reduction, really, to ensure that someone's remaining safely in the community until we can get them into the treatment services that they vitally need.
And it is this team, through behavioral health, that has that exact training. Motivational interviewing is a good evidence-based practice example that Colleen brought up. They're skilled in being able to get people engaged when they're ready to be engaged and move them through that process even to be ready to be engaged. So that's why it's so important that we have resources like Colleen and Katie in the community, because they're the ones that are trained and skilled to really assist these individuals with those issues.
If I could ask a follow-up question to better, we were talking about two populations and where they intersect. So there's people who have substance use disorders. There's people who are homeless. Colleen and her team, they work in the overlap in the Venn diagram where you have people who are homeless who have substance use disorders, and you work with people who are homeless who have other issues. Commissioner DeBone is expressing concern about how we address substance use disorders in our community, and it would be helpful for me to understand if we're thinking about those overlapping populations, like how big is the overlap? I mean, how many people are there who have substance use disorders who are homeless versus not homeless? How many people are there who are homeless who have substance use disorders or not? Because the package we're talking about, it really deals with that intersection. If there are a large number of people who have substance use disorders who are not homeless, this package that we're discussing today, it doesn't deal with those people. And I mean, we got Molly and Janice here who may want to talk, bigger picture about dealing with people who are not homeless who have substance use disorders. But I want to be mindful that there is a certain amount of overlap, but these are not completely overlapping populations.
They are not completely overlapping, that's correct. So we have individuals for certain in our community that have substance use disorders that are not homeless, and in a minute Janice can talk a little bit about some work that's being done for that population. In terms of the population that we deal with, the individuals who are homeless and have substance use disorders, one of the main things is, and you brought it up on Wednesday, housing first is really important. If we can have low barrier, no barrier, or housing first models for this population, you often see people who can get into housing then be able to get clean. It can be pretty difficult to get clean when you're out there homeless and running into all the different barriers that Colleen was talking about. And I was looking at a study this morning, and I think it's from Finland. A community member actually sent it to Colleen and I. They went to a robust housing first model for people who had SUD disorders and who also were homeless. 4 out of 5 of those individuals maintained their housing. Once they were able to get into housing, they maintained their housing and were able to move towards sobriety. So in terms of the numbers, though, Colleen, do you have an assessment on that in terms of the homeless and SUD?
Yeah, and I think that's a really good point. And when we talk about kind of coming back to the data, when we do the point in time count, that's kind of where we get our data points. I mean, I can talk a little bit about what we see in the community versus the snapshot of what a point in time account is. But when we ask those questions of reasons for homelessness or other demographics, other barriers that someone might have, it's often not self-reported from someone that they say that they have a substance use disorder. So when we talk about that, or a mental illness, and so when we look at the data from that, even federal lens, it's all self-report. And so we know that it's a severe undercount. I can say that when we go out in the community and we're engaging with someone, and I have made this comment before, we don't necessarily go up to someone and ask, are you hearing voices? Oh, you aren't? We're not going to help you today. We have a little bit more finesse in the way that we approach individuals. And sometimes we might be interacting with someone in the community that, might not appear to have a substance use disorder, but they do, that we're meeting people and seeing them for where they're at and where they present to us today. And so I think that that's just an important characteristic that we talk about, is that we when we see there's very visible individuals in our community that may be struggling with mental illness or substance use disorder, but there's a large population that also are struggling with those different barriers that aren't as overtly evident when you're interacting with them. And so to that point, I would say the folks that we're interacting with, over 80% of them probably have some level of underlying substance use disorder and or mental illness.
So the people that you are providing behavioral health services to, but the overall homeless population, I mean, do you have any kind of a feel for, how many of those people are having, and I very much appreciate, your explanation of, there's not a whole lot of self-reporting on this, but it's one of my concerns in the homelessness discussions we're having at the policy level is a perception that perceptions that all homeless people are having mental health challenges or substance use disorders, that there's people are often unwilling to recognize that, we have working people, we have families, we have unaccompanied children, or unaccompanied youth out there. And so I want to, one of the things I want to make sure I understand is just, how common is substance use disorder in the homeless population overall?
Yeah, I think that's a great question, and it's a really a fair point and an important point, because again, we want to challenge some of those perceptions in the community, because that isn't the overall population. In the overall population, I think what we see in Deschutes County that, it's a hard number to really identify for you, Commissioner Chang, but I would say probably about 30% of the overall population of those experiencing homelessness probably are struggling with a substance use disorder. And that, again, and sometimes we aren't engaging in defining what homeless definition we're looking at as well. But that is what my best guesstimate would be.
We won't cite you on.
Great, thank you.
So if we have another couple homeless services staff people, they're going to have relationships with X amount of people out there. Success looks like one at a time, moving them out. So the ask is for $1 million. So, and you saw me go through this process yesterday. Just how do we take step 1, 2, 3 here to making a decision?
I have a question on what Colleen said. Colleen, I wrote down that you said over 80% were substance use disorder and mental illness. What were you referring to of that 80%? Because you just said 30% were substance use disorder. Are you saying that the 30% don't have mental illness? They're just substance use. They're just the drug users. So I'm just trying to clarify your percentages.
Yep, so the over 80% or 85% that I mentioned are the folks that we are engaging with on a more daily or weekly basis. Those are the people that we are having contacts with that I think that have a underlying substance use disorder or mental illness. And the reason why I say that is not 100% is because some of those people we're not necessarily engaging where we can do a full diagnosis of what is going on for them. Specifically, to Commissioner Chang's question, when I talk about the whole homeless population of people experiencing homelessness in our region, whether that's Deschutes County or not, we're not engaging with we don't know all individuals experiencing homelessness. So when we look at that number, that I'm saying about 30% of those probably have a substance use disorder.
Okay. I remember we talked a couple of months ago at an event in Bend, and we were talking like, both you and I were thinking the count was about 1,500 in the county. And I'm just wondering, has the count, have any of them moved south for the winter? Have we seen any traffic south? Do we have any idea?
I don't have any necessarily statistics on that, but we do have people. It is a transient nature of this population. We do see a higher numbers in Central Oregon in the warmer months than we do in the winter months. We will have our point in time count in January that will hopefully get a little bit better sense of those numbers. And there's some movement to getting some more quality by name list quality data that will have better statistics for you on that. I know that there's been a lot of movement within the population, especially in the city of Bend, just because of different events that have taken place. And so people have moved throughout the county quite a bit and trying to find a safe place to live. As far as going south, I have not heard of that necessarily.
Thanks.
Okay, well, so I was just going to, so this is a financial ask for 3 years for 3 people, plus supplies and a vehicle. And it's going to be homeless services from the health department. It's going to be warm relationships with as many people as possible, really focusing on anybody who's ready for movement, stabilization and housing. There's an ask from the city of Bend, City of Sisters in La Pine, 2 rural cities, for this half-time person. So this is that ask that we're responding to, part of this. We've got, X amount of people homeless right now. This is going to be a very meet you where you're at, warm support. And it doesn't go very far. I guess, so we're still stuck in that big picture of, the Martin versus Boise, and we're not asking anybody to go anywhere. We're just offering warm connections if you're ready to go somewhere. Just acknowledging where we're at and how much we're going to spend on that. Because then we started to talk about legislative stuff yesterday of maybe we asked the legislature for, siting authority of some sort. Say, okay, well, we need a location. Because we're not even getting close to asking somebody not to be where they're at. We're just going to come meet you where you're at. Just acknowledging that's. So the expectation of a city council may be, there's 100 people. How are we going to help move them out? But we're not even getting close to that.
I think it's important to look at this. We need to look at this request both discreetly and in the bigger context.
And that's what I was doing. Yeah.
There are all sorts of questions in the greater context about, where are we going to provide shelter, transitional housing, affordable housing? This does not address that, as you're saying. There are all sorts of questions about, governance and whose responsibility. Addressing homelessness is, how do we pay for it? What's our plan? What's our overall strategic plan? This proposal doesn't deal with that. And what's important, I think, to emphasize is that this request deals with what our core responsibilities are. So within the world of homeless, tackling homelessness, providing behavioral health services to people who are experiencing homelessness is there's no dispute that is one of our core functions. That is part of our job. We have received a substantial amount of federal support to do that work, and I think that's great. But setting aside these much larger questions of what is our overall comprehensive approach to homelessness, I think we need to recognize that the request before us is for our core activities, our core responsibilities what's the phrase, the authority, the local public, there's the local public health authority, but then as the local mental health authority for this community, this is our job. And we've heard from staff that the interventions that we are providing with the limited staff that we have are highly effective. And at tracking people out of homelessness into a new place, and that they could do more if they had more capacity. So I think in my mind that is a solid argument for supporting this proposal. Again, setting aside the bigger questions, which are
my point.
which
We're
are
dealing with bigger questions here. We're going to do some warm outreach to people in their place, in wherever they're at, ready to take whatever step they're at, and it's a very very loving and educational outreach opportunity for somebody who's ready. But there's a lot of people that aren't ready for anything.
Well, yeah, there's a lot of people who aren't ready for. There's a lot of people who aren't ready to move. The more people,
The expectation of the city councilors is we're doing something, and we're going to do something. We're going to make warm relationships with a lot of people. I'm just acknowledging that there's other elected, bodies that are asking us to do something here, and I'm defining what we're doing. And that's what we're talking about today.
Can I add to that? Because I think, when you look at these positions, yes, they're going to be going out into every community. So we'll have case managers stationed in every community and split between Sisters and La Pine. But there are also these services that will be going towards these projects that are coming. Project Turnkey is coming in Bend, and Project Turnkey is coming in Redmond. And so without these, we won't have the behavioral health services to help those two entities. So we do have places that are building up and providing more beds. that will enable Colleen's team to engage with people in the camps and get these individuals to these shelters. And then also, this will be the services, the behavioral health and the SUD services for those shelters that are coming up as well, and probably the navigation.
And it's wonderful. As I say, as county commissioner, we've got this population that are dispersed camping and on the side of the road or whatever. We're going to offer them services, but I mean, there's just nothing real. There's no hard lines in there, and, I'm just acknowledging that, this is a step, but I don't know that, some people may expect it to be more than it is. I'm
So,
trying to talk that through a little bit.
so next Tuesday, I was just talking to Gwen this morning early. She said she's opening up with, I think, 8 rooms or something. She needs to find another 300,000. Venting in the bathrooms was all totally not efficient, had to be replaced. So I'm just wondering, are the people that are funneling into the Redmond turnkey project through Bethlehem Inn, are they already in, is there already an order of people that are going to be funneled in there? Have we already started doing that?
Yep, so actually, we heard a presentation this morning from Bethlehem Inn in regards to what their process will be for referring folks to the Redmond shelter. The hope is that they're having an inspection again today, that they can open up today. They're working with individuals at their current Bend shelter that have connections to Redmond, that work in Redmond, so that it is, not taking somebody out of their community to place, to have them have access to permanent shelter in a different community. And so that process is in the pipeline, if you will, and the process right now is for individuals that are wanting to access those beds, and while they work up their staffing, is to contact the Bend shelter, and then the Bethlehem Inn staff will work with those individuals to really ensure what is the most appropriate referral for them at that time.
Okay. And I just did have a question about, you were asking for a new vehicle for $60,000. It just so happened this week, my son sent me a pickup pricing at like $47,000. So what is it you're wanting to get that's $60,000? I mean, I know vehicles right now are really extremely high. There aren't that many of them available. So what is it you're looking for that's $60,000?
We met with our operations team about the cost of the vehicle. And so I think that, obviously we would try to find something less expensive if we can. But we're looking for a 4-wheel drive truck that's a crew cab that also has area in the back so that we can have storage of supplies in the back of the truck as well.
Okay.
If it's okay with the commissioners, I just want to back up a little bit. I think it's really important to understand that these are skilled positions that we're proposing be hired. So this, yes, of course, they are doing warm outreach and engagement activities, because that's what any behavioral health professional is trained to do, as a way to connect with people that most folks in the community probably don't know how to talk to and feel uncomfortable talking to. So that's a core skill we have. But these are case management roles. So they are doing skill building, they are doing resourcing and referring of people, they are doing assessments in the field, they are walking alongside individuals, helping them get connected, and offering other skilled services. And it's really critical to know that they're part of a behavioral health continuum of services at Deschutes County. So when you have these folks working with folks who are experiencing homelessness, they're also connected to all of the resources we have in-house. The other thing I think sometimes gets lost in the conversation is, the community, for probably really good reasons or unfortunate reasons, has a picture of homelessness in this sort of monolithic way. They see encampments. Colleen's team is working with people that are not housed in all sorts of situations. They may be in a motel, they may be living with a relative in a really unsafe situation where their substance use can't be addressed because everyone in the household is using. They may be in and out of homelessness. They may be in their car. And they're often being seen by the Crisis Stabilization Center or by our early assessment, our ESA team. So this team is doing core work with all of the other clinical teams that connect people to psychiatry, additional services, and housing, and is really focused on those people experiencing homelessness that have mental health disorders and/or substance use disorders. So I just want to keep the focus on the population we serve,
Yeah.
what we're trying to accomplish on behalf of those individuals. And frankly, that population has grown significantly in part as a result of the pandemic and all the sort of sequelae that came from that in our community. The needs have grown, and I'm concerned about our ability to do what we basically must do for our mentally ill individuals if the team remains the size it is. So I just want to be sure we're keeping this within the scope of what we do and understanding there's this whole backdrop, larger conversation that has to be addressed in other settings, frankly.
And yeah, I'm just trying to kind of acknowledge that this is a subset of,
It is a subset.
this is just, yeah, I mean, that's exactly where I was going with this.
Yeah.
I mean, yeah. So a couple of examples of what I saw yesterday. I just, thinking that one gentleman was from Klamath Falls, worked summertime fire events, came home after the summer, and his girlfriend had moved to Bend to be homeless. That's what they said. Oh, we moved to Bend to be homeless. So that they're just here. So he followed her here, and they're not even together now. So he's out there by himself. Another gentleman's his winter plan is to be in the front seat of his car. When it gets cold, he turns on the engine and stays warm. And he just got to make sure he gets his something checked and go get some gas when he needs it.
Yeah.
We tried to explain him the day there's 6 or 8 or 10 or 12 inches of snow out there, you're not going to be able to drive. And he was from Iowa. He moved here just because he had heard somebody. These are just the people I met yesterday afternoon. Another gentleman lost all of his documents. He's just kind of lost. So, I mean, that's real tangible. Well, let's get you a birth certificate and get you going here. He was kind of half in and half out of even wanting to do that, but he knew what he needed to do. So that was an interesting situation. And then, as I say, the SUD person that I didn't meet, who wasn't there, but the message was, yeah, we know who she is. She's struggling mightily, but she's not asking for help, so we're not doing much for her until she's ready. So, those are 4 examples of people I saw yesterday. So, out of those 4, if we hire one person and they keep warm relationships with all 4 of them, maybe we're going to get documents for one and he could find a job and hopefully get going. It's interesting, that catch-22 about motivation and where they're going to go. So I'm not judging, I'm just trying to digest it.
Yeah,
Could I ask-
what I would say to that is don't forget about shame. And that what people tell you, Commissioner, as an elected official.
Oh, and I was
with
just Joe
status
Guy standing there.
about,
We were
their
with public safety,
choices.
but yeah.
Sorry, but what they're telling you about their choices is a way to try to hold on to dignity. And my guess is that anyone who's telling you that in their good judgment, living in the front seat of their car in the middle of winter is a good plan, may in fact have some underlying conditions that we could illuminate by building some connection with that individual and connecting them to services. So
Oh, no, I'm fully aware of that, and
Yeah.
I did not introduce myself as commissioner. I mean, we were there with public safety and
Yeah.
homeless services, but, I was just Tony, the guy standing there saying hi, trying to communicate.
yeah.
Well, you
I
have
just
the-
wanted to, I also just wanted to emphasize that your experiences yesterday are a snapshot in time. And as someone makes contact, it often takes multiple contacts with someone before they open up to you and are receptive to what you have to offer or what you're hearing. And I mean, particularly the 4th example you mentioned of the person who's experiencing substance use disorders. One of the things, it may take a couple of times before that person is interested in talking about what they're experiencing and working on it. May never happen, but it might. And one of the things that I was speaking with Janice with about a few weeks ago that I found pretty interesting, and I wanted to ask to kind of all the 3 of you potentially to elaborate on is kind of the what we know about people cycling in and out of substance use disorders and coming out of it. So I know that there's people, that people sometimes experience, they have substance use disorder. They were able to get sober for a while. They may have a relapse, but kind of in like a like looking at it longitudinally over time, what are the statistics around people working their way out at a certain point? And, because that is a backdrop for what we need to discuss, is basically, if there is a pathway for someone to work their way through and out, maybe it's 1 step forward, 2 steps back, 2 steps forward, 1 step back for a while. But if there's an end point where they work their way out, part of our question is, what are we willing to invest to support that process happening?
So, what we know, so I'll start with the good news. What we know is that most people with addiction recover at some point in their lifespan. And this is why we work so hard to save lives with harm reduction efforts, with homeless outreach, with substance use treatment, and why many of us hang in there with people year after failures. We know that relapse and recurrence of either mental illness or substance use condition is part of recovery. So our commitment is to work with those folks until they really recover for an extended period of time. So that's the good news. The downside is, yes, we experience that people relapse. Another kind of comparison, and this is another way that people become homeless, is looking at intimate partner violence situations. We know that many women who are in extremely violent relationships leave those relationships 5 or 6 times before they leave permanently. Many of those times when they leave, they end up unhoused. And it's a very similar dynamic. The systems that you need in place to get safely out of addiction, safely out of mental illness, safely out of violent situations or a family that's unsafe is safe housing and adequate supports. And that's what we try to provide with these services. I don't know if that was responsive to your question, but.
Yeah, and I mean, your very first point was a direct answer to my question, that
Yep.
the majority of people who experience substance addiction will work their way out of it. That's, eventually. And, I mean, if you want to elaborate on at all on that, I'm kind of like,
I mean,
how long that can, how fast or how long, how fast that can happen, or how long it might take.
it depends on. I would love to come back sometime and talk with all of you about adverse childhood events and what we've learned about trauma history and the kinds of choices people make, because we talk a lot about choices, but we sometimes don't understand what goes into the stew. And we know now from huge population studies that exposure to childhood trauma, loss, abuse, harm, actually results in the trajectory of people's life choices looking very different as they enter adulthood. That has a profound impact on how people recover from and how quickly they recover from addiction or violence or mental illness. It's very much a part of that story. So anytime you would like to have me come back and talk about that, I'd be happy to do it. What I can say is that it just depends. It depends on their premorbid functioning. It depends on how quickly they connect to resources. It depends on how much damage they've done to their physiological, their spiritual, their psychological system in their addiction, how quickly they recover. And I understand that the community gets fatigued with this cycle, that we see the outward evidence of what that can look like in a life, and it's hard to see and hard to understand and can be exhausting for communities trying to deal with it. People like Colleen and the people who work with her, they power through that fatigue and stay hopeful, and the result is that lives are saved and people are rescued out of those situations. And those are really the services that we are trying to support with the proposal, and lots of other times we come before you.
So I mean, with that, with that long view, I just want to emphasize that if you go out on a site visit and in that snapshot in time, you don't necessarily see a substantial amount of progress, like on that one day, it doesn't mean that it's not coming.
I would, as an experienced adult with a lot of interactions in my life, I see that.
Okay.
Thank you.
Commissioner Dare.
Well, I just wanted to bring up the fact that talked to Rimrock this morning, and they are hoping to open their youth center in Prineville. But of course, they are having problems still, with staffing, but they've got a new theory going, a new plan they're implementing in order to, get that staffing. So, that's something that our area truly needs. It's for teenagers, younger people. And I was really glad to know that they are part of it. But then again, I heard the story at Thanksgiving that there was a homeless person sitting in front of a really, really nice hotel in Seattle, and they offered the gentleman an apartment. They had an apartment for him, et cetera, and he kept refusing it.
Yeah.
So, we've got that issue. And then this week, I heard from someone that was driving through Bend, and they were attacked in their car by some homeless people. So, there are all these sides to what we're dealing with, and truly, it's an overwhelming problem. And the fact that if we've gone up actually to 1,500 individuals in our county, I think that's, it's a daunting task for the team. And I'm just wondering, adding these people to the team, are those people all then licensed? Remember that license that I kept talking about, that only 20 people had? Will these hires all have that license already? Because I know it's really, you said took a couple years to get it otherwise.
Our intent is always to hire people that have a CADC, always. They are few and far between. We have just implemented with your support, and we're very.
Could you explain that? I remember hearing about that, too.
Yeah, it's the Certified Alcohol and Drug Counselor credential or certification, Certified Drug and Alcohol.
Counselor.
Yeah. Sorry, the acronyms, I get lost in them, too.
There are too many.
A lot of.
You let it slip right by, but yeah, let's talk about it.
Yeah. It is a credential that allows someone, even who doesn't have a master's degree, to do things like a quick substance use disorder screening and provide substance use disorder services to individuals in any number of settings. So the intent would be to recruit for people with a CADC, because that population really needs people with those skills, and we don't always get those individuals. Now we have an incentive package. In fact, one of my chores for today is to send an email to all staff to remind them that we have an incentive package that was just approved by the union and by the commissioners to incentivize people to work towards that credential.
I mean, I think that is so important, and especially when you consider the percentage of people that, are either drugs, alcohol, whatever, that are homeless, and if you're going to work with them, you've got to find a way to do it. And then where can we send them? I mean, to get help for alcohol, where can you send someone in Deschutes County that has an alcohol issue?
You can send them to us.
Okay.
You can send them to Best Care.
Best Care does it?
Absolutely. Best Care, in fact, is probably the provider of choice locally for outpatient drug and alcohol services. They provide our detox. They provide Brooks Respite. Rimrock does it. Pfeiffer and Associates. I believe
Serenity Lane has an
Serenity
outpatient here.
and Drishti as well does some substance use disorder. There are a number of outpatient panel providers in addition to the county and Best Care who provide substance use disorder treatment.
Okay, because I just know that the problem is bigger than the three of us.
It's yes,
Way big.
But then again, you have the problem where if somebody doesn't want help, how many days would you how many days would you go up to that gentleman at that nice hotel and just say, clearly he has a mental health issue, I would think, and, create a relationship. But, this was in Seattle. Seattle has had such a issue for a long time, and I'm wondering, how come no one in Seattle has been able to move that man into housing?
Yeah, and not knowing the circumstance, I can speak from personal experience. My approach would be to continue to show up to meet with him as much and often as he would be willing and allow me to do so, because it's repetition and it's continuing to show up and to say, I'm still here even if you aren't wanting what I'm offering to you, but to remind you that this is a resource for you. And hopefully over time that individual, we can address what some of maybe the fears are of accessing housing. And maybe if it's not the housing that's being offered, what else can we offer you that might not be the mainstream, what we think you need, but what is it that you think you need?
Well, and that sounds like the scenario of the gentleman who passed away here in South Bend last year, a year and a half ago. I mean, he was offered services many times, right? I mean, I don't know if,
Oh, the man who is the paraplegic?
yeah.
Yes, he was offered housing, yes.
But can you offer us a counterexample of, someone who you had to come in contact with a number of times, but who suddenly that day came when they said, oh, I'm ready to do something.
Well, that was the example earlier, too.
Yeah, I mean, I have probably many examples. I think one of the ones too of, the family, the couple that was living on BLM land in Redmond, time after time, hey, we have an opportunity for a shelter bed, or we could get you into these other programs. And there was hesitation because, these were mainstream benefits and different things that, there was hesitation. What do you expect from me as I go into that? But it took 8 years, and finally, and I think there's also a fear of, oftentimes we show up and say, somebody wants something right then and there. And if we can't provide that right then and there is hesitation, and there's different issues that we need to overcome. But the example that Commissioner Adair mentioned that's the importance of why we continue to show up and say, even though we don't have that, we're going to continue to show up and figure out how can we connect you to what it is that you do need. And so it might take 8 years, it might take 6 months, but over time we're really able to kind of meet folks where they're at, and hopefully, and it might take 6 months to get off a housing wait list. And so it's important to continue to show up.
Thank you.
So next question, is there any statistic opportunity here that could be shared with the commissioners, even if it's not public information, just outreaches, successes, because I was out there yesterday and they're like, oh yeah, remember that time we did this and it was such a huge success. We don't hear about it. And, these are personal, private information, possibly, there's not a whole lot you do want to talk about sometimes in public, but we need to know some of that because, the headline is person passes away in Bend and in the community, and then judgment happens. You're like, well, wait a minute, he was offered services how many times? So, yeah, I mean, it would be helpful to either have a, public report or at least a generic report in the public with more information for the commissioners possibly. Because this is the topic of the day that we're seeing. It wasn't like this just a few years ago. We've always had a transient dispersed population, but all of a sudden, just like our experience with East Redmond, remember as staff, we were closing gates and putting boulders up all over the east side of Redmond. That was a horse trail recreation area, and all of a sudden it's been taken over, and the gates get run over and broken and taken out, and the rocks get moved, and multiple times. So it was aggressive. So it changed just recently.
I think the statistic that Molly talked about earlier, and it's really just a first look when we were looking at our smaller CCBHC expansion grant population, and we use a tool to track homelessness with that and a number of other things. And we did see a distinct decline. Actually, I was surprised by how big of a drop in homelessness for the small population we were able to follow over time. We're not... The struggle we always have in an organization like ours is we're a service organization, not a research organization. So often we know that people want to know what is the evidence that this works, and to really create that meaningfully, sometimes you have to be willing to set up a study population and deny services to some people and provide them to others and see where you end up. And that's research. We don't get to do that. We just have to serve. But I do think that survey data was very promising. It was surprising to me. It was a significant drop in homelessness for that small population. And I hope to expand on looking at that. That will still be one of the things we measure if we apply for the expansion grant again in this cycle and get it.
What year was that, Janice?
That was for the period from 2018 through the extension of the expansion grant, which ended June 30, 2021. And we had 13% homelessness. It went down to, I think it went down to 2% at the end.
After a year
Yeah.
of treatment initially, yeah.
Yeah. So I acknowledge those are really valid questions, Commissioner. It's sometimes a struggle for us to get that data easily as a service agency, but we work towards that.
Well, I mean, so as a, budget authority person, here's $1 million, and I hope it went to something positive. I mean, that's the conundrum right there.
Well, we're certainly willing, and we've had to do this as part of writing grants, we're certainly willing to say what would look like success to you and develop some things that we measure that matter and are meaningful, and report back to you. I mean, that's our commitment to you always,
Yeah.
that we're willing to tell
Well, and
you.
this is for the community. I mean, it's not just me, it's us.
Right, well, you represent them.
Yeah, exactly. I mean, it's, I'm just trying, yep.
Yeah, we are happy to do that, as long as we're measuring things that mean something. We don't want to do meaningless widgets.
Well, I know, and I agree. I mean, that would be bad if you're like 3 hours a day doing paperwork, 2 hours a day out in the field, and the rest of the day, trying to put fuel in the vehicle and trying to get ready for the next day, and then we don't have much. I know.
Well, you look at the $1 million that the community all came together and spent on Veterans Village, that's, transitioning with 15 homeless veterans, and hopefully within 2 years, they'll transition and more of them can come in. But we definitely, we've heard from Lapine that they would like that same program. And, someone I'm working with in Redmond wants to provide that program, some land where he bought. So truly, we've got to get the transition. And then, the opioid overdose number, remember in 18, the number was 70,000, and that was horrific. And now it's over 100,000 of opioid overdoses. All these other things that have happened through this pandemic that really are quite overwhelming. I just feel like we've got to start making some kind of progress, and to hear back, okay, so if we start working with someone, we actually got 3 people placed this week or this month or whatever, we are making a dent, and people are, they're ending up in a much better and safer place, because winters are 7 times more dangerous. And we truly are going to have winter someday soon, right?
Someday.
Yeah.
We're hopeful.
So I would hope that we could have some kind, we could have some kind of regular check-in about this, and I don't want to track I don't want to track what you're doing week to week, but at like 6-month increments or year increments, if we could have some evaluation. And I don't know exactly what that looks like. It might be an expansion of the survey that's already been completed, or it might be some other methods, or it might be just some kind of kind of output metrics of what you've done. But I think that would be a helpful piece of the package to have to be able to hear back on progress.
Yeah, I
And-
think the survey would lend itself.
Colleen and I have talked about some other tools that we could
Okay.
utilize as well as, and things that we would like to track. So we absolutely, we would like to do that.
Mhm.
Yeah, I think that's the goal. I mean, we also want to be good stewards of the money and responsive to the community, because homelessness is at the forefront of a lot of these conversations. And, as we've written grants to expand our program in the past, we've mentioned different matrix tools, one of which is the self-sufficiency matrix tool that Bethlehem Inn uses with their residents. Is a easy tool that it does go over 30-day increments. We could do it at 6 months, and that's easy enough for us to do. And we are currently doing it with our enrolled clients through the PATH grant as well. So there is some of that that we could be really easily implemented and report back. We are here to provide that information to you and answer any questions that you may have as this issue is going to continue to increase over as we've seen.
So Colleen, my question is, this point-in-time count that the government has set up in January seems to be, like, okay, what if we're in a blizzard? It's so impacted. I really, knowing the count at Hunnell Road was 35 in January, it was 85 Memorial Day, and it went up to 111 now, someone who does accounting for me. I would hope that we could maybe if it's not too expensive, do a count in June and see, okay, we've got our January count, and it seems like that takes months to get that number out. But then maybe do a follow-up count. Are we spending millions of dollars, and are we making a difference? Because in 6 months, I would hope that we would be making a difference.
Yeah, and I think that's a great point, and I know we've had that conversation in the past of wanting to do another account. The Homeless Leadership Coalition just recently was selected as a new cohort. If you aren't familiar with the Community Solutions Built for Zero, it's where the theory of meeting functional zero as a community, meaning that we have enough resources in our community for all those experiencing homelessness. So we just recently launched in that cohort to be a part of this nationwide movement for Built for Zero. Which started in November. And so part of that is creating a quality by name list, so meaning that we are going to have real-time data of all individuals experiencing homelessness in our community, again, real time. And so where are those people experiencing homelessness in our community? What services are they accessing? And where are they moving throughout the community? So that we know the stories behind those individuals, not just a one-time snapshot that happens, in January, which we know is just a severe undercount.
Yeah, it's just not impactful enough.
The other thing about that, because that question, it's a good question, it always comes up on why in January. From some research I did was that's when shelters are full. In the warmer months, people are more dispersed, and it's actually harder to count. But it certainly would be useful information. But that's one of the things I've learned about why it's in January.
So Commissioner Dare, we're getting down to the ask from health very specifically. As you see, I'm working my way towards yes. I'm just.
So you want to fund it for 3 years?
Well, as I say, I'm generally, let's figure out what we want to do. This is my point. Yeah.
Right. I know. I'm just hoping they can find the people that will take these positions, which seems to be pretty difficult in this job market.
Yeah.
But I don't know, 2 years. I mean, I know if you're saying it's a short-term position, then it's really harder to get someone to take it. So that's the one thing that I
and
go
then
3 years over.
This is 3 years, so then there's the magical grants out in the future to extend a program like this, or an ask from the general fund, or other funding opportunities. So that's coming back to a budget hearing near you someday. And yeah, the health is amazing. I mean, it just keeps growing. And we've just heard that we're going to have ask for pandemic support and relief, COVID, big dollars asks coming from health. And what's the right size? What's the right investment? We do have growth in the county, obviously, and population growth. On this topic, homeless services, outreach, management, the joint office of, we've got a lot of work to do in the next.
Well, the homeless population probably grew by 400 if you take it at 1,100 in January to now.
Yeah, and it's important to recognize it's not just something we're experiencing locally. At the state level, the rate of homelessness is increasing. At the national level, the rate of homelessness is increasing. There are the factors that produce homelessness are national in scale, state in scale, local in scale, and so it's not. This is not something that we're just gonna it'll work itself out here at the local level in a couple of years if we just kind of let it be. This is with our country, our state, and our community for years to come. And we have the opportunity through this project, this proposal or this request, and through the bigger picture to put a dent in it. And so that's why I'm supportive of these this request as forwarded to us for $1,065,000 for a 3-year period.
Is that a motion?
Are we ready? I mean, I want to let everyone talk through all their questions, voice all their concerns
I-
before I make a
Molly,
motion.
do you think there are more than 44 in La Pine homeless? I've asked someone that
Oh, yeah. No, it's just burst camping, yeah, up and down
Because
Darlene
I'm
and
like
Power Line
going-
roads, and there's people all over.
I know that the Darling Fire was started by them, and they do,
I would assume that 100 number, so.
okay, because I was thinking, okay, if we have 110 and we're talking one employee for only 200, it seemed,
Yeah.
anyway.
But
Okay, I
again,
just want to be sure there are more there, that we're not overfunding one side of the position and the other behavioral health specialist is going to have a bigger group of people to work with.
Well, and the service will be in Bend also, correct? I mean, this is for the county. This
For all
isn't,
four.
there's an ask by a half FTE by the City of La Pine and City of Sisters. This is countywide outreach and support.
Correct. And that 44 is the number of individuals enrolled with behavioral health services that are homeless.
Yeah.
So it's definitely a much higher number out there. And yes, these case managers and peers will go around the entire county. But we'll also have them stationed in different areas of the county so that they're there rather than right now they're stationed in Bend and have to travel, et cetera.
So, yeah, as I say, the observation is this is a small, warm outreach effort for people that are ready for help. This really doesn't ask anybody to not be settling in long-term on public lands around the cities. It doesn't really, draw any hard lines for anybody at this point. I mean, it's a step, and it's a wonderful step, obviously, but, how much of this investment is going to be able to be, leveraged with the other housing opportunities coming online? There's this concept, the Joint Office of Homeless something, I don't know whatever that's going to be. I mean, you've got a strategic plan coming out, which, maybe we need to be talking about that. That's part of this.
We have a strategic plan coming out.
Well, yeah, so you're representing the county, and I'm ready to get engaged in that, whatever it is my point, so. And, yeah.
Actually, in the,
Because if this is, this is $1 million asking, oh, yeah, we got another 5 million here and 10 million there, it's going to be great if we spend all this money. Okay, so
Yeah.
I don't know if that, what.
No, we definitely need to have a much broader discussion about those broader questions. To me, this is a matter of our core responsibilities as the local mental health authority, and an opportunity to have a real impact. I mean, we understand, we've heard about the survey, we've heard some specific stories that we can extrapolate from on what kind of an impact our behavioral health homeless outreach team can have on this problem. And so I very much appreciate that there are a lot of larger scale, broader discussions that need to be had, but just focusing in on this specific request, this is our job. This is something that we know has an impact and is effective, and I think it's completely appropriate to expend to make this kind of an investment.
Let's fund this. I'm not opposed to just giving this the runway for 3 years, but yeah, let's take some good time. I mean, what about, public, and I don't know, could we ever have an executive session? Kind of like the MCAT handoffs where you're talking about names and what happened in the last 12 hours by name, by activity and the thing. Could we ever do that in executive session just to get a better feel for what's going on? The public health or private health information.
Yeah, I mean, there might be a way to find that.
Or we could do it individually too. I'm just,
Mental health or public health board, but I'd have to look at that. That'd be kind of unique.
I'm just thinking out loud about, if we just wanted to get up to speed, what happened in the last 6 months? And some of it could be very personal information. That's why I would say
You
that.
could use identifiers, client 2, client X, something like that, but,
So then we do it in a public meeting and a work session for the world to hear too.
well, and, yeah, again,
I think the world would like to hear it.
Oh, yeah. But, and I was just trying to figure out what would,
And the some of the kind of like semi-annual or annual reporting we're talking about, the evaluation, I think that's a great answer to the question of everything like, well, the press picks up on these sensational incidents that happen, but, are they tracking, the day-to-day work to put a dent in this problem? And I think that's those sessions are a great opportunity to put the proactive story out there about the work that this team is doing every single day to impact this problem.
Yeah, I'm ready for a motion if we want to proceed here.
Okay. I move approval of allocation of $1,065,000 of American Rescue Plan funding for a 3-year period to support homeless outreach countywide services as proposed in this request. Is that
Okay. I'll second it.
Okay, it's been moved and seconded. Any other discussion? So I will add that, there's a discussion of a joint office, something, legislative discussion, a navigation center. We've heard about, historical facilities, the Multnomah facility that was the place for people for almost 100 years. We maybe have to do some big structural changes in the state of Oregon. Land use puts us in a box, and I know that's different opinions on that, but I think there's some common ground about, where is that Martin versus Boise location, and how can we get there? So there's some big discussions there too. So I'm just pointing out the other parts of this that we're not getting to today. Anything else? Discussion?
No, I do want to make a motion after this one for the Sisters Cold Weather Shelter, because they did lose the one church, and I'm not quite sure what that community is going to do, but I wanted to give them like minimal funding, like 10,000, just so they know that they can like find something to, in case we have a cold March, April,
So that's a different topic.
Right,
let's
after
close up
this one.
So
yeah, we can discuss
all
that.
in for the vote, Commissioner Chang?
Yes.
Commissioner Dare?
Yes.
And Chair votes yes.
And commissioners on that.
Thank you for the discussion.
Thank you, Commissioner.
Gets to be a pretty narrow path sometimes.
No, we really appreciate they're smart questions, they're hard questions, we appreciate it, and we are happy to come brag about our work.
Oh, yeah, come brag. That's what we want to hear, yeah.
Yeah.
No, I really want to hear it like in at least every 6 months. I mean, maybe even, and if you have something really to brag about, come sooner, because we're spending a lot of money, and I look at it, we're spending money, and we're not spending money on rooms or anything. We did that. We're going to have 88 rooms in Redmond, but it hasn't quite opened up yet. So it just makes me nervous. I don't want people, getting them somewhere positive would really be helpful.
We'd be happy to come back in 6 months. It'll probably take a little time to hire, although these positions should be easier to hire than our BHS2 positions.
So do you think we need to offer housing? I mean, I know, no, really, no, I meant really, if you want the right people to work the job, and, okay, so what if we said, okay, we've got a month of housing for you or something? I mean, housing is so tight here. How do you get someone to move here?
Well, let me say that HR has been working with us on, within the rules of pay equity, on occasion helping people with moving and housing costs as a way to, it's not a hiring bonus, but it's a way to offset some of the difficulty of coming to this area. We've been very grateful for that flexibility. We think it's smart, and we think we're going to be able to hire these positions relatively quickly, honestly.
I mean, I was just at St. Charles for the infusion, and there were like 10 nurses there, and they were all basically from Florida, and they're put up in hotels, and I'm thinking, how much is that costing? But, to get people, and actually, we want people to start sooner than later, so, good, I'm glad to hear that, Janice, thanks.
And we saw our neighbor Jefferson County buy a home and offer it as part of the compensation package or a relocation, transition support for people who they're trying to hire. So we may need to keep up with the Joneses.
The Jeffersons in that case.
The Jeffersons, there you go.
Again, thank you.
Okay, so Commissioner Adair,
Yes.
bullet number 2.
I do believe that we should allocate, I was looking, they were asking for 50,000 for 3 years. I know this year is pretty well covered, but if we could at least offer them 10,000 to help with assisting. They definitely need something. Weather can be bad, February, March, April, you know.
So who writes who a check? So Deschutes
Well, no,
County,
I think-
ARPA dollars to who?
I think this should go through the city. You know, that's where the letter came from. Support for, well, they're supporting
Right,
it.
City.
This, I don't know, or do you go the Sisters Cold Weather Shelter Operations? They're the ones that have the problem with their financing, and they were asking the city to do their financing, so.
They're the ones, okay, so a little clarification on that. They have the capacity to do their own books. They asked the city if they would do it for them to save them money, which is, in my mind, a strategic thing for a nonprofit to do. But it doesn't mean that they don't have the capacity to do their own books themselves. What I've heard from, first off, the Sisters Warming Shelter Board are the people who run the warming shelter. The warming shelter does not happen without the people who operate it, the service providers. And what I've heard from them is that a chunk of, a small chunk of money to rent space may or may not be helpful for what they need. The 2 months of church space that they do have is they don't have to pay for that. So if churches are willing to sign up to host the winter warming shelter, they're not asking for money. So throwing $10,000 or $50,000 on it may not be helpful. It might. I mean, there's a possible scenario where they say, hey, we could lease this space for a couple months, and we need $30,000 or whatever. But we haven't heard that from the Sisters Warming Shelter Board, the people who operate the warming shelter. So they have said that they want to come back to us with a revised request, and I think that we should wait to hear what that request is, because I'm not persuaded that if we gave $10,000 or $50,000 as the Sister City Council letter proposed, that it could be used to address the need at hand, which is additional months of warming shelter.
So if there's a clear ask in the future, there's generally support. I would say that for myself. I guess I'm asking. I mean, so
Yeah,
the answer would be
I
yes,
really
but
want to,
good.
I really want to help, but
Yeah.
I want to know that there's actually a plan instead of, yeah, if you throw $50,000 at this, maybe they'll be able to find something.
I wasn't talking about throwing 50, I said 10. I'm just worried if we do have a late winter, since the winter's hasn't gotten here yet, February, March, and April, that's 3 months. Think that our unit that we had from Mid-Oregon sat empty for almost a year. They didn't want to rent it. I believe the annual rent for that is $25,000. I'm not sure what they are able to find in Sisters at this moment in time. Who wants it? Do they want it next door? Sometimes it's just a little tricky, and, okay, so we're going to wait on this, and I just feel like it's scary. February, March, April, it's not that far away.
I'm eager to support a request whenever we get a viable plan. But
Well, they asked us for $1 million. That was our first half.
Yep, and
So-
we did not support that plan. We haven't supported that plan. We also haven't supported a an abstract request from the city for $50,000 to help rent an undetermined space, which may or may not exist. In my mind, in the ideal world, what we would get is we would get a proposal from the board of the organization that operates the winter warming shelter, that's supported by the city council of the city where the winter warming shelter would be located. But we haven't gotten that. And so I don't, until we get a proposal that's viable, I don't think we can make an investment.
So there's.
Well, this letter
there's-
was written on October 20th. That's when they had 3 churches.
They-
They no longer have 3 churches. They only have 2.
This,
So-
this letter
Here, how about, I mean, there's support for something.
Right.
Let's go.
I
back and
just-
do it again and figure out who we would write a check to and what.
Well, I just want them to truly get on something that is going to work,
Yeah.
because I worry about the winter.
Let's work with the city council on that and whoever's.
Well, no, I think it's actually the group, the cold weather shelter
I
people.
mean, how about this? I mean, we could incentivize the planning and collaboration that needs to happen by putting, a chunk of money on the table and say, like, we're holding this for,
$20 for some coffee to have a discussion.
we're holding this money for you to come up with a viable plan. Do you want to do something like that today?
And we're talking, I'm sure we have the money.
Commissioners?
It's not
Yeah.
necessary.
If I might, just chime in on this. So the conversation, I've actually talked with one of their board members about this, and they stated that they needed to get back together as a board to discuss a plan, as Commissioner Chang's talking about, and I haven't heard back from them yet.
Yeah. So it'll come around again.
And if and when it does, if this helps, we can turn it around really quickly.
Yeah, good. So, yeah, there's intention of partnering with something. Okay, is there anything else? So thank you very much for.
One thing, going back to the
Good to
previous item that was approved, does the board want to coordinate communication back to the City of Sisters in Lapine? Might be, just to let them know that it was.
That's a great idea.
That would be great. Are you
I'm
offering
happy to-
yourself up to do that coordination?
I'm happy to communicate with the city managers, or if the board wants to reach out to their elected officials, that's another option.
Well, let's put just a paragraph together saying we've responded to your request for a half FTE by, doing this with the health department, hiring a few folks, having resources for them for the next 3 years. So, I mean, let's put that in a couple sentences.
Sure. And would you like that, staff can draft the email, but do you want it to come from the board or?
Oh, I'm thinking a letter.
Letter?
And, as an attachment, so, because it's all signed by the mayor there. We can sign it, all 3 of us, just acknowledging that this is because it'll be a nice thing to look at.
And
Send
I'd
it to
real-
each of their inboxes.
And I'd really like to look at if we have some land down there that we could do a similar to our Veterans Village in Bend, if that's a possibility.
Where?
Insist.
In Lapine.
In-
Lapine, there's a lot of veterans that are homeless down there, and truly, people are asking. And if it's a successful program, and if we have, 100 homeless vets, and we only have, 15 here, if we could do, get something going, in less than 3 years?
Yeah.
Hopefully, maybe a year, since we,
St. Vincent de Paul is doing that here in Bend also.
I know, which is great.
Yeah,
but, when you've got 1,500
Yeah.
homeless, it's a huge crowd. Anyway, I don't know if we have down there.
I asked, when I heard about this concept for the Lapine area, I asked, I immediately turned around and, it would need to get built, and we know that's a big project, but it would also need to be operated, over, years and years and years. And so I immediately turned around and asked Provo, whether they were ready to commit to managing an additional veterans village. And they said, well, it's a big lift, but if that kind of opportunity was there, they would figure out how to do it.
Well, it's got to be easier having 15 people in one location versus, driving around the community in the forest, talking to people and actually getting them more services. I'm really thrilled that Veterans Village is open. Thank you to the Tobiasen family.
And the Ben Heroes Foundation.
Going back to the communication to the cities, we'll draft a letter that the board can review on Monday. Also, Whitney actually has a draft press release that can go out today if the board would like, or we could hold off on it. Is there a preference?
Press release, and let's go ahead and just acknowledge it in the minutes on Monday, but let's put a letter out today too, if we can. I mean, we should be able to get something together in the next hour. It's just a couple sentences acknowledging it.
Yeah.
In line with the press, because then we can email it to the city councils too. It'd be fun. It'd be positive,
Yeah,
very positive.
we'll draft the letter and send the press release to the
Yep.
to the cities.
And then we'll acknowledge the letter in the minutes on Monday. How's that? And
Sounds good.
it's Friday, almost at noon. Okay, anything else?
There-
Got through that one.
Is there a decision on the 50,000?
No action at this time for Sisters Warming Shelter, but shown support.
Yeah, but,
something.
and we're outreaching to the City Council of Sisters to say that we're ready to invest. We need, in my mind, we need a unified plan from both the people who are operating the winter warming shelter and the city that will be hosting it.
Yeah, perfect. Great, thank you.
Okay.
The only other item there is the list that's attached to
Oh.
the staff report, if you care to walk through any of those items or not.
Not today. I'm not
No,
ready
thank
for
you.
that either. Yeah.
We do that next time.
At some point, we'll start doing that again. And we need time like this. I mean, maybe we set up another ARPA discussion outside of a board meeting, or if we don't have a busy Wednesday afternoon sometime, just come back on the second half of the day and just kind of open this up slowly and then get to something.
I could see there being items that need to be unpacked pretty heavily, like that.
Yeah, so maybe that's the same thing. But that'll be the future, the near future, maybe.
Great, thank you.
Okay, anything else? Meeting adjourned. Today, what's today? Oh, it's Friday.
Recording stop.